Let's talk about vitamin D and its benefits for health. So let's start. Vitamin D is a fat soluble vitamin in a family of compounds that includes vitamin D1, D2, and D3. Your body produces vitamin D naturally when it's directly exposed to sunlight. You can also get vitamin D from certain foods and supplements to ensure adequate level of the vitamin in your blood. Vitamin D has several important functions. Perhaps the most vital are regulating the absorption of calcium and phosphorus and facilitating normal immune system function. Getting enough vitamin D is important for typical growth and development of bones and teeth, as well as improved resistance to certain diseases. Here is more information about the benefits of vitamin D, plus information about downsides, how much you need, and foods with vitamin D. Number one, vitamin D may fight disease. In addition to its primary benefits, research suggests that vitamin D may also play a role in reducing the risk of multiple sclerosis. A 2018 review of population-based studies found that low levels of vitamin D are linked with an increased risk of multiple sclerosis, decreasing the chance of heart disease. Low vitamin D level have been linked to increased risk of heart diseases such as hypertension, heart failure, and stroke. But it's unclear whether vitamin D deficiency contributes to heart disease or simply indicates poor health when you have a chronic condition, reducing the likelihood of severe illnesses. Although studies are mixed, vitamin D may severe flu and COVID-19 infections less likely. A recent review found that low vitamin D levels contribute to acute respiratory distress syndrome. Supporting immune health. People who do not have adequate vitamin D levels might be at increased risk of infections and autoimmune diseases such as rheumatoid arteries, type 1 diabetes, and inflammatory bowel disease. Number two, vitamin D may regulate mood and reduce depression. Research has shown that the vitamin D might play an important role in regulating mood and decreasing the risk of depression. A review of 7,534 people found that those experiencing negative emotions who received vitamin D supplements noticed an improvement in symptoms. Vitamin D supplementation may help people with depression who also have a vitamin D deficiency. Another study identified low vitamin D levels as a risk factor for more severe anxiety and depression. Number three, it might support weight loss. People with higher body weight have a greater chance of low vitamin D levels. In one study, people with obesity who received vitamin D supplementation in addition to following a weight loss diet plan lost more weight and fat mass than the members of the placebo group who only followed the diet plan. In an older study, people taking daily calcium and vitamin D supplementation lost more weight than subjects taking a placebo supplement. The researchers suggest that the extra calcium and vitamin D may have had an appetite suppressing effect. The current research doesn't support the idea that vitamin D would cause weight loss, but there appears to be a relationship between vitamin D and weight. Vitamin D deficiency. Several factors can affect your ability to get adequate vitamin D from sunlight alone. You may be less likely to absorb enough vitamin D from the sun if you live in an area with high population or high pollution, use sunscreen, spend most of your time indoors, live in a big city where buildings block sunlight, have darker skin. The higher the levels of melanin, the less vitamin D your skin can absorb. These factors can increase the risk of your vitamin D deficiency. That's why it's important to get some of your vitamin D from non-sunlight sources. So, what are the symptoms of vitamin D deficiency? The symptoms of vitamin D deficiency in adults may include tiredness and pains, severe bone or muscle pain or weakness, stress fractures, especially in your legs, pelvis, and hips, A healthcare professional can diagnose a vitamin D deficiency by performing a simple blood test. If you have a deficiency, your doctor may order X-ray to check the strength of your bones. If you receive a diagnosis of vitamin D deficiency, a healthcare professional will likely recommend that you take vitamin D supplementation. If you have a severe deficiency, they may instead recommend high-dose vitamin D tablets or liquids. You should also make sure to get vitamin D through sunlight and foods you eat. Risk of getting too much vitamin D. If you take excessive amount of vitamin D supplementation, you may get too much of it. However, this is unlikely to happen through diet or sun exposure because your body regulates the amount of vitamin D produced through sun exposure. Vitamin D toxicity can lead to an increase in your blood calcium level. This can result in a variety of health issues such as nausea, apathy, vomiting, abdominal pain, dehydration, confusion, increased thirst, etc. Some food sources of vitamin D. Some food contain vitamin D naturally and others are fortified with it. You can find vitamin D in the following foods: salmon, sardines, herring, canned tuna, cod liver oil, beef liver, egg yolk, shrimp, regular mushroom, and those treated with ultraviolet light, milk, certain cereals and oatmeals, yogurt, orange juice, etc. How much do you need? So, well, there are different opinion in the medical science and among the doctors, but the recommended dose from WHO is around 600 to 1000 per day. But the latest research showing that we need much more than that, and I personally have 5000 IU per day. So and make sure to have proper diet. If you're not taking the supplements or going out in the sun is the best option as well for naturally getting the vitamin D. So that's it for today, and there will be much more videos like that, so please subscribe our channel and please press the bell icon as well. Thank you very much.